The country has tonight recorded 307 positive cases of COVID-19, the highest in a single day since the pandemic hit the country back in March. But even as the government warns that these numbers will continue to rise, health officials want Kenyans to be responsible and help the government to contain the spread. Our very own Enock Sikolia reports on why health experts are alarmed by the COVID-19 spike.
300 and counting coronavirus infections reported in 24 hours, the highest since the virus made its way into the country. And it is this spike in new cases that is worrying government. A report by the Ministry of Health obtained by Citizen TV shows that cases are spiraling and pressure is mounting on hospitals with new admissions on the rise. For instance, in the last 24 hours, 29 COVID-19 patients were taken into Kenyatta University Hospital, increasing the number of those hospitalized at the facility to 222. During this period, 10 patients were admitted at the Kenyatta National Hospital, 9 at the Nairobi Hospital, and 3 at the Aga Khan University Hospital. The number of people hospitalized for COVID-19 across the country hitting the 3,519 mark.
Going forward, I think we are likely to see more samples turning positive.
Despite the government employing the home-based care strategy to lessen the burden on health facilities, the virus continues to spread deep into the population, increasing the number of people in need of hospitalization. The virus has now taken root into 41 of Kenya's 47 counties. Nairobi remains to be the epicenter of the pandemic. Today alone, 154 people tested positive to the highly infectious virus. In Dagoretti North, 34 cases were reported. Other city estates that recorded high numbers in terms of infections include Kibra with 22, Embakasi East with 18, Langata 18, Starehe 17, Westlands 14, and Embakasi South 10. Mombasa has been Kenya's other epicenter for the virus and recorded the second highest number of infections across the country. Of its 38 cases, 22 were registered in Mvita, 10 in Likoni, 5 in Changamwe, and 1 in Nyali. Machakos County posited 33 cases, Narok 20, Kiambu 17, Kajiado 14, and Busia 10. The increasing number posing a challenge to the country's healthcare system. The government says it is upping its game to ensure hospitals, doctors, and nurses are not overstretched.
This challenge will be here with us for a while, but work is in progress, I think, in terms of recruitment of the initial 5,000 healthcare workers.
But the ministry is alive to several challenges it faces as it battles a virus that has left the world on the spin. The report from the ministry points out that contact listing and follow-ups is weak, with several counties failing to submit contact tracing reports. The ministry also talks about the delay in relaying laboratory results, something that has made it difficult for positive cases to be isolated on time. The government is also blaming Kenyan communities for the spread of the virus. The ministry says some Kenyans have simply refused to adhere to measures put in place despite the virus spreading into the community.
It requires the citizenry also to play their part and take that responsibility. And together, I think we can beat this pandemic.
Enock Sikolia, Citizen TV.